Welcome to the 5-Minute Drill Down. I'm Dr. Phil Klein. First, a quick shout out to our sponsor, Microcopy, a great company that continues to lead the way in rotary instruments. And right now, good news, they're offering a free test drive kit, which includes their most popular diamonds and carbides. To get your free kit, visit microcopydental.com/Viva. In dentistry, it's often the smallest tools that make the biggest difference. And dental burrs are a perfect example of this. These tiny little instruments are used every single day, yet the decision of which burrs to purchase is far more consequential than it may seem. The right choice directly affects your efficiency, your overhead, your clinical outcomes, and ultimately the experience you deliver to your patients, making this a decision no practice should take lightly. Now, while burrs may look similar, they differ in how they're manufactured, how long they stay sharp, and what procedures they're designed for. Some are built for precision, others for durability, and some are for cutting through specific materials. That's why it's important to look beyond appearance and learn more about the burr's attributes and what it's actually designed to deliver. And here's a common misconception. Dental burrs need to be expensive to be good. The truth is that's not necessarily so. Price isn't always a reliable measure of quality. A good burr should deliver consistent sharpness, efficient cutting, and predictability. If it provides those results reliably, it's a good burr, regardless of its price. Another important consideration is whether to go with single patient use burrs or reusable burrs. Now, at first glance, reusable burrs may appear more economical, but that's only part of the story. The time, labor, and cost involved in cleaning and sterilizing them add up quickly, and even then, a burr is never quite as sharp after it's been used. When you factor in performance and efficiency, the value equation begins to shift. Single patient use burrs solve these problems. Every procedure starts with a fresh, consistently sharp instrument, which means less chair time, smoother preps, which we all want, and more predictable results. That efficiency reduces stress for you and your team, minimizes scheduling delays, and keeps your day running on time. In short, single patient use burrs don't just protect your patients, they protect your schedule. Another factor is the materials you're working with. More and more practices are placing restorations made from hard ceramics and zirconia. These materials are durable, but extremely challenging to cut, especially with a standard burr. That's where specialized burrs make a difference, and there are several good ones out there. A popular one is Microcopy's Neodymium Z-Class, which is specifically engineered to cut through zirconia. It allows you to work quickly and efficiently without dulling prematurely and wasting chair time. Now, of course, there are other considerations. You'll want burrs that match the procedures you do most often, whether that's crown and bridge, direct restorative work, or ceramics. Reliability is critical. You want a burr that performs the same way every time. If it's hit or miss every time you start with a new burr, it's time to look for a new burr manufacturer. In the end, choosing the right dental burr isn't about buying the most expensive one. It's about finding the burr that gives you the best mix of sharpness, durability, safety, and efficiency. Whether you're considering the benefits of a single patient use burr or a specialized burr for hard materials like zirconia, or a combination of both, the right choice can make a noticeable difference in your practice. Remember, the smallest tools often have the biggest impact. Once again, many thanks to our sponsor, Microcopy. Don't forget to order your free test drive kit at microcopydental.com/Viva. And I hope you join me on the Dr. Phil Klein Dental Podcast Show, available on Spotify and Apple. We drop 2 new episodes every week, and there's always something new to learn. I'm Dr. Phil Klein. Thanks for watching.